How would you describe the public healthcare system in this country?
It's in a state of dilapidation. Basically, I mean, I'm not going to mince my words. It's in a state of dilapidation.
The public healthcare system caters for 45 million people. That's according to the 2017 figures from Stats SA. It's a sector that's heavily criticized. So, what's wrong with it?
If you look at the nurse-to-patient ratio, doctor-to-patient ratio, it's not synonymous with that of the World Health Organization, one. Two, staffing. I mean, there's a gross shortage of everyone within the healthcare sector, so they ought to make available more funds for staff. Medications, I mean, it is rather disheartening to realize that more often than ever, there are shortages of medication in the country. So those two, I think they're right at the top. And last but certainly not least, and looking to infrastructure and so forth.
In 2018, over 200 billion rand was set aside for public health care. District health services got 90 billion rand. 38 billion rand to central health services. Provincial hospital services received 34 billion rand. Facility management and maintenance received 8.5 billion rand.
One cannot point at anything good about whatever money was given to the healthcare sector. There's so much wrong that it is difficult to pick up any good, if any, for that matter. I mean, if you look at the recent cancer scandal in KZN, so where are those billions? I mean, the provinces, for instance, Eastern Cape, I mean, how many oncologists does Eastern Cape have?
These are the things he hopes the finance minister will address when he delivers his budget speech.
Money should be directed to infrastructure first and foremost. Secondly, well, the infrastructure, it includes equipment. Secondly, medication. And lastly, remuneration of people on time. As you can see at the moment, currently there's doctors, I mean interns, commissars, etc., that are not paid appropriately.
But will Mboweni deliver? Malungelo Booi, Johannesburg.